Good afternoon, everyone. Gareth Presch, CEO of the Global Social Prescribing Alliance. I'm delighted to welcome you to our Global Social Prescribing Alliance webinar celebrating Social Prescribing Day 2024. I thought the video that I just shared there was very relevant to today's discussion. And we have our distinguished guest with us here today as well. Really under pressure. It's just Mike, we really are under pressure. The health service at the moment is facing significant challenges, but I do believe we have solutions. I believe the social prescribing is one of the provides that opportunity to bring solutions to the forefront of medicine. Let me just welcome James, Cristina, and Christopher here. James is going to kick us off and give us an insight into the work and that the Global Social Prescribing Alliance has been doing. And then we'll hear from Chris, who's lead of Arts and Health for WHO. And then Cristina, who's joining us from Portugal. James, let me just give you the floor and hand over to yourself, and so you can set the scene.
Thank you very much, Gareth, and good afternoon, everybody. It's a real delight to be speaking here today about the massive global reach of social prescribing, the opportunities that we have across the world to transform healthcare. As Gareth said, healthcare systems in all areas of the world are undergoing significant challenge. In most modern developed health economies, we see the challenges of the real advantages of the fact that we are living longer lives. Over the last 70 odd years, life expectancy in most developed areas has increased significantly, and that's been obviously a fantastic achievement of modern healthcare. However, we know that there are limitations as well. We know that antimicrobial resistance, addiction to opiates, and also the social barriers that people have to gain good health and well-being outcomes are really significant and create several challenges for people living in communities right across the world. Social prescribing creates an opportunity to shift our view of health, and that's why I think it's so exciting, and there's been so much global interest in the movement now that has really taken a huge pace, a huge increase over the last few years. Social prescribing fundamentally at its core is all about giving people the opportunity for meaning, connections, purpose, activities in their lives, some of the building blocks of what it is to be a human being. And actually, when we look at the opportunities to connect people with their health in new and innovative ways, we see the massive opportunities through the arts, through sport, through knowledge, through environmental activities, creating an opportunity for people to determine ways of improving their health and well-being in a more effective and more natural way. Social prescribing has taken off massively in the UK, in England, through work that the NHS has done. The 2.6 million people have now benefited from social prescribing over the last 5 years. And what we're seeing across the globe is many countries in Canada, in US, in Australia, Singapore, across Portugal and other areas of Europe, many countries adopting innovative models to connect people effectively with activities in their local communities. And we're seeing that this is really having an impact on the way in which we can deliver healthy communities across the globe. We set up the Global Social Prescribing Alliance in 2021 alongside the WHO and the National Academy for Social Prescribing. And since then, we've gone on to co-produce a playbook for social prescribing, which is available for anybody across the world to utilize as a resource to enable them to tap into the key areas that need to be in place in order to deliver good social prescribing. And at GSPA, we have a vision that we want to connect globally with organizations, with governments, with the voluntary community, faith and social enterprise sector, with people that are all committed to delivering health in a new and innovative way. So I'm really excited to hear from the other speakers today with examples of how social prescribing and arts and sports and nature-based activities are transforming health across the world. Thank you. Gareth, back to you.
Thanks, James. And I really appreciate you setting the scene. And that connection and that purpose. And we'll move swiftly on to Chris. And the reason I want to move swiftly on to Chris is because he's going to share his experience from his recent trip to Ireland, which is extremely close to my heart. So Chris, over to you. You're on mute, Chris. Sorry.
No wonder I was so eloquent. So thanks a lot, Gareth. I think it, like many people, when I first heard the phrase social prescribing, I was a bit skeptical. Is this, read these 2 sonnets and call me in the morning kind of thing? I worried that it would become overly medicalized and mechanistic and linear, transactional, as prescribing, leads you to believe. But what I found in practice as I've traveled the world and looked at actual programs is that it's anything but. It's really about communication. It's looking at creative expression and sensory experience as a health behavior, just like nutrition is a health behavior, just like exercise is a health behavior. It promotes health, it helps you recover emotionally, it puts things into context, into meaning, and helps you find reasons for hope. And that, I think, is a tremendous advantage. Ireland is one of many countries that has successfully used social prescribing. I just did a tour of the west of Ireland, where I saw nursing homes, I saw programs where they used link workers to reach remote populations, people who have been excluded from society. And that could be because they're an older person who has chosen not to go to a nursing home. So the link workers go to them and start talking with them about how what's important to them and supporting their activities and making them connected to a larger whole. Or it could be a workshop I did in Newcastle West with a travelers group, and they quite deliberately did not want to be part of an organized health system, or any system for that matter, and which brings up a lot of issues of how do you provide continuity of care to a group that is not in any particular place and mistrusts, in many cases, an organized health system or any organized system at all. And in that case, they used quilting circles. They found an artistic practice that was meaningful, particularly to the women in that community, and formed these circles where public health officers would join them and would identify themselves as such up front. And they would start to do what quilting circles have done since time immemorial. They would ask each other, "So how are you?" And if issues came up, there would be someone there who could lead them to the services that could help provide a solution to their problem, as well as the circle itself providing a sense of community, of meaning, of processing what they were going through, and imagining what their lives could be like in the future. I think some of the most moving examples also were in the nursing homes, where music, visual arts, movement was used to tap into memories and aspirations that perhaps were a little bit more hidden because of just age, but also conditions of older people, such as dementia and Parkinson's. To see, one of the things I discovered in Ireland, for instance, is that the music of Johnny Cash is incredibly popular. And in one nursing home in Galway, the musicians began to sing Ring of Fire. And a woman who had dementia and was not particularly responsive, suddenly her face lit up and she began singing along. And to take advantage of that connection, when the song was over, the musician would then ask her, "Do you remember the last time you sang that song?" And she would remember from her young adulthood being in her parents' farmhouse and warming herself by the fire. And when that song began to be played, she took off her shoes and she danced on the cold stone floor. The memory was that specific. And then in response, the musician would take out a book of Irish poetry and read aloud the poem, The Planter and His Wife. And so this would go back and forth, these awakenings, these moments of connection, and giving them something to look forward to for the next time that they came. And then lastly, I think, and this is all connected, the use of social prescribing in Ireland to manage transgenerational trauma from the Troubles, from the upheavals that Ireland has historically been heir to. And one of the ways that they look at it is how to bring about a sense of perspective and awe to not just traumas that you may have faced, but have been faced in the course of time that may have affected us on a deep level that we're not even consciously aware of. And it's that notion of awe that I found particularly intriguing, where when you are exposed to a beautiful landscape, of which Ireland has plenty, or a piece of music that deeply moves you, or a painting that can draw you in to an imaginative world, that you feel the sense of being in the presence of something larger than yourself, and rather than feeling diminished, you feel like a small but important part of a larger whole. And neurologically, we were rewarded with that, with a shot of oxytocin, which helps us reinforce that sense of bonding to each other, to the world around us, and even to our past and potential future. This is one of the neurological underpinnings of artistic engagement and why it can be so powerful in those kinds of circumstances. So those are a few of my reflections on my Irish trip. I hope they were useful and enjoyable. Thank you.
Thanks, Chris. Really appreciate that. I think it emphasizes the quality of life, that improvement in our quality of life that the arts brings to our well-being, to ultimately. Let me pass on to Cristina now from Portugal. And Cristina, I think you have your presentation as well to give. You're more than welcome to add that. I'll add that to the screen. And the stage is yours.
Thank you very much. Thank you very much. Thank you for the kind invitation, dear Gareth, Presch, and to Global Social Prescribing Alliance. This is a great day. Portuguese Health Literacy Society in Portugal is also part of the Global Social Prescribing Alliance. And also greetings to this wonderful panel. So we work on social prescribing in arts, music, dance, but today I will speak about social prescribing, the Portuguese case from steps to hugs, an emotional and physical approach to activate elder people with cancer. Let me tell you that I start with this former CDC Roper that described public health as the intersection of science and politics. This is quite interesting. So we know that current national debate includes healthcare reform. And we know also that prevention it's also absent of these discussions. And we know that health in all policies and settings must have a place. So we have a great lack of policies to activate older people with cancer. So we know that more than 50 cancers of deaths among men, and we have more than 36% among women. And all of these cancers are based on behavioral and environmental, occupational, and metabolic risk factors. We have some reasons for this because we have 50% of the population with low health literacy. We have lower income and education levels, large disparities in cancer risk factors, especially by gender, especially in men. So cancer remains one of the biggest health problems. And we know leading risk factor for cancer deaths in Europe countries is tobacco, alcohol, occupational risk, air pollution, etc. And all of these are based 70% on behavior. So if you know that 40% of the cancer burden are explained by behavior, unhealthy lifestyles, metabolic risk, poverty. We know also that 50% of the people is difficult to access, understanding, use the resource, navigating the health system. So health literacy will be the bridge to activate people, but social prescribing is the perfect trigger to make people healthier. And the report of OECD 2024 says that Portugal is leveraging its national healthcare system to deliver brief counseling on nutrition, counseling, and prescription of physical activity with training provided to health professionals. And we have here social prescribing. Science says that physical activity done by elder people with cancer or survivors improves the quality of life and prevent recurrences. So what we do, we make a partnership with stakeholders from health, education, social, culture, patient association, more than 10 companies. And we also know that today we have public policies for active elderly. And what about elder patients with cancer? So we make this partnership based on health literacy, and we have 3 branches: social prescribing, physical activity, and to competence and motivations. So for social prescribing, we include medical doctors, oncologists, and general practitioners. And for physical activity, we have a physical protocol made by Portuguese Health Directorate. And also we have the support of the municipality of Lisbon, integrating social and health. And we also develop competence and motivation with participants, with training sections, with co-creation, polymedication, nutrition, oral health, diabetes, vaccination. And you have an add-on that is a daily telemonitorization to see how people is on this health. And what we want for tomorrow, we want public policies for active elderly with cancer. And we join health literacy, social prescribing, and communities. And thank you to Gareth Presch to these inputs and to this impulse to make this true. And this is some image of the activation of the people. They are doing co-creation after a session. And I will try to go forward. And this is we have a high level of satisfaction from the people who make physical activity. This is quite interesting. This is the stakeholders we have a mentor. This is Vasco Fonseca, is the mentor of this From Steps to Hugs. It's a medical oncologist. And I don't know if I can put this video. I will try. No, okay, doesn't matter. So what we want that with social prescribing and this Portuguese case From Steps to Hugs, we have what Christopher say, transforming people. And it's all about communication also. And is to transform not only healthcare, but transforming people. And this is a great opportunity to meaning. This is a success case from emotional and physical approach. So to activate elder people with cancer, and this is quite good. Thank you very much, Gareth.
Thanks very much, Cristina. And just pass over. Thanks for sharing that with us. And such a fascinating insight into how social prescribing is being adopted across different disciplines, particularly to support elderly patients with cancer. Let me go to Saeeda next. Saeeda, who is one of our board members. Delighted to welcome you, Saeeda. And please share your thoughts and aspirations for social prescribing and the work you've been doing with the Alliance.
First of all, thank you so much, Gareth, for the invitation. And as you know, I'm a great fan of what the Global Social Prescribing Alliance has been doing even before I joined the board. I think in terms of my own reflections, I'd probably like to start by saying that we've had an over-reliance of pills, medication, and surgery. And obviously, in so many instances, that is the way forward. But it's not the way forward for people's mental health, for communities, for people feeling needed, wanted, etc. And some of what people are coming to see doctors about, or admitted into hospitals, I would actually see them as social reasons rather than, for example, medical reasons. The other thing that for me feels really important is that somehow there's a disconnect that's occurred between globally empathy, compassion, care for one another. Human beings need that to survive. It's not just about having something that takes your headache away. It's about feeling like we are valued, we have purpose, and there's people out there that care and respect us or love us as well. So the GSPA, in terms of what it's doing and the global footprint, and as you know, I've already started working on this internationally, in terms of creating a footprint where we can roll out a model which looks at social prescribing, and not just social prescribing, but looking at the wider values that social prescribing actually sits upon. Things like innovation, creativity, community and social related responses to the growing health related issues that the world is facing. I believe that with the global social prescribing alliance and what we're trying to do, what we're not doing is to try to take the same model and apply it in exactly the same way everywhere, because from city to city, town to town, from community group to individuals, everybody's different, and that the value of what we have is based on the strength in our differences and how we can utilize and learn from one another in terms of creating a model that improves the overall wellness of individuals, of families, of communities, and nations. So it's not just looking at it from an individual point of view, that it's just about us. It's about our interconnectivity with humanity and also with nature, because a lot of what social prescribing is about is interlinked with nature-based prescribing. So I think that through innovative and I suppose genuine partnerships all over the world, what we're actually able to do is to not just help make things better for people, but we can actually make things better for the planet and for climate and for climate related causes, as well as planetary health. So this is not the beginning, but it feels very early, even though it's like 2021. It's going on to sort of 3 years now. However, 3 years is nothing compared to the life of the planet and also people, and making sure that everybody feels valued and everybody feels like they have a place, and we move away from medicine as a way to deal with the symptoms, to go back to the root causes of what makes people sick and lose their health, and move it to a model of wellness, of happiness, and prosperity in every sense of the word. So thank you for basically everything that all of you and us are involved in and will be involved in. And I'm looking forward to bringing lots of wonderful partners to make our goals implementable actions all over the world.
Thanks very much, Saeeda, and I really appreciate you sharing the insights and the opportunities to spread this through innovation, which I think is very critical, and the work that you're doing internationally to support this work. Let me go to my clinical colleague Vasco, who I'll hand over, who has a presentation, who I can actually bring to the stage as well, Vasco. If you want, you can just ask me to press on the next slide, and I can bring that forward. So, Vasco, the stage is yours. I'll just let you have the floor just as a short intro.
Hello. It's a great honor to be here with you to talk about this thematic. First, I would like to say some words. I think we are trying to design the world. I think what social prescribing is to understand what is to be human, and I think we will see this now. Now we are talking about artificial intelligence and humans, and we are trying to design the world for humans. And in humans, we understand, it's very clear when we study the need of connections, of human connection. And I think what we are seeing in medicine is that. So I am a medical oncologist. I begin and I am specialized in geriatric oncology. But when we try to treat the patients, the elderly patients with cancer, it's very obvious that the social dimension it's more important than the treatments. So I don't know if I can put the slides. Okay, so I begin a PhD in the area of social science. It's not usually for a medical doctor, and what I try to understand if it can we design public policies for geriatric oncology. So the public policies, I think maybe not everyone knows, it's the idea of the state, the public administration have answers to the people. So they design public policies. And the idea of this PhD is what public policies should we make for geriatric oncology. And if the biosocial area is so important as the biomedical area. So I understand that social innovation to public policies for elderly cancer patients can be important. So I study a lot about bioethical questions. Then what policies do we have right now for elderly patients, for elderly patients with cancer, social policies? And if we can change behaviors with public policy behavior, if we can change behaviors and we can design new policies. And that was the idea. And in this idea, what I think that we have three goals: health literacy, because if the patient needs to understand why social prescribing or why the social dimension is important. About the idea was a policy of sports, so of physical exercise, because we know that physical exercise, it was very important to this patient. And the idea was, how can we make a physical exercise that is good for loneliness? The idea comes with a professor of human kinetics. It was collective exercise with a ball. It's not what we are seeing, but it was the first idea. So we design this study to give answer to the elderly patient with collective exercise with a ball. So when we send the ball, we make connection with the others, and with health literacy. And so can we pass? So this idea of the empowerment of patients, it's very important, and sometimes health literacy it's not made for this subset of patient. And how Cristina have talked before and how did we make this project? First, I study in theoreticals, then we go to the field, and we understand multidisciplinary teams. So the difficult to implement a project like this one is because we have people from social area, people from medical area, and we need to listen to all the patients, all the participants, all the actors in a policy, and we need to work together. I think this is one of the most important things. We have different political actors, and how can we work together? When we are designing a project, then we want to go. What I understand, it's a transdisciplinary project. Every different actors, for example, medical oncologists, health literacy, human kinetics, have this role. So I think in the future we will have politics that change the behavior of the citizens, and this will be a new setting of public policies, and we can make experience with people, with small groups of people, and to understand if when we try with this small group, like our project Passo o Braço, if it works, we can go and try to use this model in another places. We can repeat this model. We can use these models of in a scientific way. And we need to understand that when we talk, and this because sometimes when people talk about social prescribing, and when we talk about social prescribing, for example, for doctors, they don't understand the importance of the thing, because they think we cannot repeat it. They don't see the scientific of social prescribing. So I think it's very important to understand how can we make scientific models for social prescribing. How can we test experience that we made with change of behavior change? For example, if we test some kind of exercise, then we can go and we can understand if the patients are better after they have done that cycle of sport, of exercise. I think we need to have some kind of scientific language in social prescribing. That will be a big change, so that we can go to different places and we can repeat what we want. And I and Cristina, what we think there are two pillars of social prescribing for this population is health literacy, physical exercise, and the other that's from polypharmacy, the drugs that the patients take. So I think it's a new world, and it will help the patients. And I will just say one thing very interesting that we have in our project, because I think we will understand quality of life with a watch. I think it's a thing that comes very different, because we are studying the sleep pattern of the patients, and we are prescribing exercise. We are social prescribing, and we are trying to understand if with social prescribing we have better quality of life, and we are having objective metrics of quality of life that we are seeing in a watch. I think this is a very, very new thing, to understand quality of life with a watch, like an Apple Watch, something. and to understand if we have scientific change when we do this kind of prescription. Thanks a lot, Gareth. It was a great honor to be here. Thanks a lot, Cristina, because it is wonderful to work with you with health literacy. And thanks a lot to the patients, because I think the patients or the citizens, I think it's the citizens, they will benefit a lot, and it will be more easy to treat. It's a great honor to be here.
Thanks very much, Vasco. Really appreciate your insights. And I think you really highlighted the opportunities that we have, particularly with AI coming forward. And actually this weekend, I'm speaking at a conference in Bologna on the future of healthcare and AI. And it's very timely. I do believe we're at a significant, we're going to face significant changes and opportunities in the future, and particularly with quantum computing, discovery, drug discovery, and key to that as well will be how do we collaborate. And I think you also highlight the political will, which is absolutely vital. I'm going to actually just bring in a colleague now who sent us a video from Cairo and covering Africa for us. I'll add Jackie to the stage now. I'm conscious that we need to also discuss brain health and the physical aspects and the transition of physical exercise as well. So Jackie's going to give us a short intro into how that works.
Hi, I'm Dr. Jackie Berry, cognitive psychologist and professor at the American University in Cairo, Egypt. Issues related to brain health and cognition are more important than ever in Africa and in the global South. Developing countries often take the brunt of world problems, and faster rates for developing cognitive impairment are no exception. Did you know that one person approximately every 2.5 seconds develops Alzheimer's or other dementia in Egypt? And with the aging population, these numbers are only expected to get higher. However, this can be prevented, and treatments can improve with the right type of support. Awareness about brain health matters, prevention and treatment are key, and in particular, making sure the screenings so important for early detection are adapted for use in Egypt, North Africa, and the global South. Unfortunately, today's healthcare system for cognitive impairment and other illness is based on a sick care model, so that steps are not taken until there is a problem. This in and of itself is a problem, as by then it may be too far gone. A better approach for health, and particularly brain health, involves prevention, early detection, and routine screenings. This approach would go a long way towards helping the already strained health services available in Africa and the global South. Thank you very much.
So I have to thank Jackie for sending us that short video. It gives us a real insight into the challenges Africa faces, but also the opportunities that we can deploy social prescribing as a solution. What I'd like to do is just get some final thoughts off our esteemed guests as we've kind of presented here today. And also, if you have any questions, we're more than willing to take them. So please do add them in the comments. But firstly, let me just go back to Saeeda, and just from your perspective, Saeeda, the future over the next 3 to 5 years, and we are moving towards a preventative model of healthcare. And do you see that transition happening on your travels?
Absolutely, Gareth. I think with the way that COVID has broken down the traditional silos. Can you hear me? Sorry.
Yeah, go ahead. I think it's just
go
ahead.
Yes. So the way COVID has broken down the traditional silos, it's enabled many of the countries which were resistant to innovation to relook at health, wellness, and interconnectivity in terms of how they look at health, climate, they look at environment of where people are living and so forth. I've already, as you know, I've been working across the Middle East. I've been to Southeast Asia, into North Africa, etc. There's a massive willingness to learn and a real buzz about what social prescribing can bring. But also, that there's also a buzz, but a need to know how to implement, because there's a difference between moving away from a clinician-based model and traditional medical models into going into what has been part of the global south for many years, where you've looked at, for example, holistic health, spiritual, mental, emotional, as well as physical health, looking at social health, planetary health, and how that interconnects. So it's going to create some amazing new opportunities, and it's going to create a real change where I see that health is going to shift from purely being looked at in a physical sense into something which is much more interconnected and holistic. And just as a positive news, I want to share with you, as you know, I've been doing a lot of work in the carbon markets and the voluntary carbon markets. I see that climate and health will be really strongly aligned. Yesterday, I signed an agreement which would look at substantial investment from climate-based programs into health and wellness, into entrepreneurship, gender equality, and so forth. So I think that some of these things are going to have an immediate effect on creative ways that we can promote healthier populations all over the world.
Thanks a million, Saeeda. And I think the new financial models we're looking at, very like that is the future of healthcare, bridging impact investors. It's one of the key topical areas for us as from GSPA's perspective, but also wider health economies. It's some of the conversations we're having. You know, we have the G7 is in June, and we're engaging with our counterparts all over the world. But let me just ask Cristina for just some final thoughts. Cristina, are you inspired by today's conversation, and what do you think of the future?
Well, we have today an old world, an elder world. In Portugal, we have more than 5,000 elder people alone. So the future is with old people. So we must improve this connection. And social prescribing is quite a good trigger to improve with health literacy. Health literacy to give competences to the people, to the professionals. And also we must have an integrated view between health and social workers. So in Portugal, we are making these efforts to join together these areas because we must benefit older people, because we are looking for us in 20 years we will be older people. So what will be my future? What will be the future of Vasco, isn't it? So we must fight this loneliness with social prescribing, and this is a good trigger for us. And thank you, Gareth, to improve this in Portugal and to make this alliance with us, because we are working on it, because people deserve to be a quality of life at the end of life. And this is the way we think that we must work together. Thank you.
Thanks very much. I think loneliness is one of the key aspects that social prescribing can help with. There's no doubt in that. I thoroughly believe that, and there's a lot of literature and publications out on that point. Vasco, a final word. Maybe you could give us an insight into AI and social change. I think we're fascinated by that, but are you excited to see this change? I think also it's what I think is very encouraging is seeing leadership from the medical and healthcare society coming to the fore to make this positive change.
I think we will see if we talk about artificial intelligence, I think we will see two types of society. And human society, that's the society that we are seeing here in social prescribing. How can we have a better human society? And I read a lot about philosophy, and we are seeing one thing that I don't know. It's quite different than what you are expecting. That's transhumanism, That's a different society that I think that is appearing right now. That's a not human society. So when we talk about social prescribing, we are talking about how humans can have a better life, and humans can have a better life with connections, lots of connections. And here we can talk a very specific question. Can we have better connections with artificial intelligence? I think so, because if we understand what is quality of life with a watch, we will understand different patterns. I love the pattern of sleep. For example, when people change the sleep pattern, what is the meaning of that? Because we are clinicians, we never know sleep pattern, but now with this watch, we are seeing these new patterns. Like we see vital signs, we will see different ways of watching for the human. And maybe we will have a better understand what is the quality of life of that person. So in the human perspective, I think we can use artificial intelligence for treat every humanity, every citizens in a better way. And we will have different health systems in the future. I think the hospitals will be different. So we will need to understand how the citizen, the patient is, but with different hospitals, because we will understand with the artificial intelligence other patterns of the citizen, and this will change completely the design of the medical field. It will be not happen all at once, but it will happen in different times. Another thing very interesting that I'm saying, because I think it's a bioethical question, and I think we need to look to the bioethical questions in longevity. Sometimes we are not looking for bioethical questions about longevity, and these questions are also so important. What we are seeing, I am a bioconservator. I believe in humans and what is human, but we can, and now it's very clear that we can see another type of society, not so human. And what are the bioethical questions for humanity in longevity that we are talking here when we talk about elderly patients with cancer? We are talking about to think in longevity, not to think in longevity, meaning quality of life, overall survival. And we'll say that it will be longevity. And when we go to an appointment of medical oncology, we will try to give a longevity treatment, and that's social prescribing. And we'll not try to just think in disease. And how can and what will be the importance of quality of life? Can we measure quality of life? And I think here it's our work with Cristina, and I think we'll have results. We have the first 2 months, and I think for one of the first times with social prescribing, I think it's the first, we will understand if social prescribing can change quality of life in a scientific way, in a measure by artificial intelligence. This is quite different, because I think this thing of when we talk about social prescribing, we are talking about science. This is a new setting, and I think it's important.
Thanks very much, Vasco. And I think you're absolutely right. This is a new science. It's a social science, and it's a change in attitudes. It's a change in the way we do business right across the world. I'll hand over to James just for final thoughts. And James, we do have a question, and I think this actually might be one for you. How is social prescribing being connected to overweight and obesity, which is quite relevant, I think.
Absolutely. So, I mean, firstly, just to reflect, I mean, it's been a wonderful conversation this afternoon, and great to see so many international partners, supporting the work that's going on and looking at using social prescribing for innovative changes in health systems. I mean, just picking up on what Vasco has just been saying, there's going to be some really new innovations and fronts on which health is going to be determined over the next few years, and AI and tech. Obviously, we've only just started to scratch the surface of the opportunities there. I think, secondly, in genetics and precision medicines as well, there's going to be a significant shift forward. And the third area for me, I think, is the one that we're talking about, is social prescribing. The realization that health starts in the communities within which we live, the environment around us. Is a huge factor in that, as we've heard this afternoon, and actually starting with those communities and starting with where people are at and the assets that they have themselves and around them is a really great way to have that focused conversation about health. I think there's scope for social prescribing in many settings, in supporting people living with obesity, in care for people with diabetes, in supporting loneliness, social isolation, in debt, in housing, and in all of those things that impact on health and well-being. And I think the thing with social prescribing that's different to some approaches to things like exercise, getting people fitter, or diet and other approaches, is that it comes from a starting point of what matters to the individual. This isn't just a paternalistic way of getting people exercising that need to exercise for maintaining their weight. This is about engaging them with community activities that are meaningful to them and that are sustainable as part of their own lives. And I think that's the big difference that social prescribing can make over a simple referral scheme. I think, the other conclusion is that whilst we have lots of pressures and troubles across the world, what we have here is a movement that I've seen over the last few years is truly without borders, and social prescribing creates a great opportunity for a global community to come together, challenged with similar difficulties in health systems and structures, challenged with similar goals of health and well-being improvements for populations. And I think social prescribing is truly something that can unite a global community. So thank you to everyone that's contributed, and thank you to everyone that's watched our session this afternoon.
Thanks, James. Wonderful way to finish the session. And just thanks to everyone who's joined us. And if you have any questions, you can post them in the comments and we'll try answer them later. We're very grateful for everyone for tuning in, and thanks to all our guests and speakers today. Do join us. You'll have more information on the website. We are building out this platform. And we're on this journey as a community, as James just mentioned. So this is part of the journey, and we look forward to the next step. We'll sign off. So from all of us here, we'll just wish you all well. Thanks, everyone, and enjoy the rest of Social Prescribing Day.